Welcome all to Think Like a Founder, a conversation on corporate startup collaboration. I'm Cait Brumme, Senior Vice President at MassChallenge. The imperative for corporates and industry players to team up with startups has perhaps never been more acute. Technology and digital disruption continue to advance at breakneck speed, leaving all industries into a future where businesses' agility counts as much as having an experienced C-suite. In 1960, the average lifespan of a company on the S&P 500 index was almost 60 years. In today's fast-paced digital landscape, the average age of companies listed on the stock exchange are just 20 years old. This means industry can't go it alone. 10 years later, 10 years ago, this was a question. And we at MassChallenge pulled and we prodded our partners to look at the startup ecosystem to find strategic and economic value. We work alongside leaders to create the case around business value. And today, this is a known fact. More than 80% of leaders at large corporations believe innovation is critical for business growth. And today, 75% of Fortune 100 companies have an internal venture capability. According to Harvard Business Research, the number of corporate investments in startup tripled from 2013 to 2018. It's no longer a question of if, but it is very much a question of how. And as we'll hear today, the question of how is a big and it's a hairy one. It touches on organizational design, priorities, budget horizons, team culture. It raises questions of model and resource and partnerships and the way work is done. And it bumps into the tedious day-to-day of compliance, security, procurement, system integration, and more. But I think we all know that the tenacity and agility of small, early-stage companies, coupled with the knowledge, network, and resources of large companies, is truly unstoppable. And while it's not easy, it's possible and impactful. I'm super excited to be here today for today's conversation on Think Like a Founder, where hopefully we'll help you learn how to pull the best of startup business creation and use it to inspire lasting change in your organization. So let's dive in. Steve and Rachna, welcome.
Thank you.
Thanks. Welcome. So I'd love to just get started with brief introductions. Steve, maybe we can start with you, and then Rachna. Just tell us quickly about yourself, your role, your company, and sort of how this factors into startup corporate collaboration.
Sure. So I'm Steve Fink. I'm the business planning director at Point32 Health. I'm part of the strategy and innovation team. For those who don't know, Point32 Health is a not-for-profit health plan that includes Harvard Pilgrim Healthcare and Tufts Health Plan and serves over 2.2 million members across New England. We've worked with MassChallenge Health Tech since its inception 5 years ago and have had the pleasure of championing 9 startups to date. As far as a lesson learned, I think to me, it's always about how amazed I am at the energy, enthusiasm, and creativity that the startups bring and how they attack these challenges and try to bring that back to our organization and infuse that into our culture a little bit.
Thank you, Steve. We can certainly attest to the tenacity and the creativity of entrepreneurs. Rachna, we're talking about you. Please introduce yourselves and tell us a little bit about what you're building.
Hi, I'm Rachna Dhamija. I'm the CEO and founder of Ejenta. We're based in San Francisco, and we're a platform that's applying AI technology that was first developed at NASA to help our customers who are health plans and health providers, and we help them to remotely monitor and remotely care for their members or their patients from home. These are typically people who have chronic conditions, and our goal is to make healthcare more proactive and less reactive. And jumping on what Steve said, I think something that we can bring, or startups in general can bring to corporates, is a bias for action, is the spirit of entrepreneurship, which is really about solving a problem. So being able to pick one small problem, introduce that to our users, rapidly iterate, and bring value really quickly.
Yes, I mean, that definitely is the Think Like a Founder mindset, which inspires us and has inspired all sorts of new approaches to business around the world. So I want to start broad and then narrow in on the work that you all have been doing together as sort of a microcosm. But to start bigger picture, Steve, share a little bit about why startups are factoring in to corporate strategy and an innovation strategy specifically.
Yeah, so I mean, first of all, as I mentioned earlier, the creativity and their ability to, really solve problems that exist in the healthcare space is incredible. So that's important. But also the fact that they're fearless, they're risk takers, and in an industry that is all too admittedly kind of conservative in nature, it really is refreshing what they bring to the table. The other thing I would mention is how flexible they are, their willingness to pivot to help solve a problem. Sometimes you start this journey with these startups and you never know where you're going to end up, but it's always in a better place.
That's it's so inspiring. If I can just follow up on sort of one point is, what have you done as an organization to be able to pull in those elements of entrepreneurial thinking, and partner on solutions that may be less natural in a traditional corporate environment?
Well, I think that there's a lot of kind of key elements to make something like this successful, but, part of it is allowing time, making sure that you're prepared. There's a lot that goes into the journey. You've got to get through hurdles around IT security and privacy and legal and things like that. You've got to build an element of trust. And, this has really worked both on the good side and on the bad side for me in working with some of the startups. But the more open and honest they can be with you at the start about, their capabilities, what they've done in the past, what they're capable of doing and how long it'll take, those all really go a long way into factoring into the overall success. And lastly, I would say, flexibility, again, being willing to pivot on an idea and, know that what you start with may not be where you end up.
Mm-hmm. And how has this conversation gone at the executive suite?
Yeah, so I think that we have a lot of leeway there. When we're talking about doing entrepreneurial type work with these startups, a lot of it is about learning and about the adventure and the journey, if you will. Now, when it comes to, down the road commercializing, then we're going to take a much harder look. There's going to be a hard ROI lens. We're going to be looking at, clinical evidence and all of that. So I think it depends when you're having that conversation. Are you talking about, kind of the upfront exploration? Or are you talking about the, okay, we're ready to commit our dollars and our time and our resources to bringing this to our marketplace? I think there are different conversations you're having with the executive suite.
It's great. It's such an important point around exploration versus commercialization and there being different objectives. And I think that also highlights why trust and transparency is so important between both the startup and the corporate partner. Rachna, I'd love to welcome you into this. What does this look like from your perspective? What has been sort of your experience navigating the corporate environment?
Yeah, and I think Steve kind of pointed out some of the benefits for the corporates. There's definitely benefits for startups as well. And so on our side, what we're looking for, Steve mentioned, is obviously our highest goal is to get to the stage where we're able to commercialize or turn this partnership into a customer relationship. But there are a lot of other benefits beyond that are equally as important to us. So for example, in our particular collaboration, which we might talk about some more, something that's important is the ability to gather data from Point32's members. So we use that both to develop our product, our machine learning algorithms are come from the data that we collect from Point32 members, but then we're also getting a lot of valuable data on how our system is used. What are the features that are important? Maybe there's new use cases that we haven't thought of. And there's a lot of other benefits that are kind of intangible. It might be a testimonial or a validated use case, which we can then use to gain credibility with our future customers or with our investors. And then just developing relationships. That's a very valuable thing as well, to get mentorship and to learn from the corporate because they really know the industry better than we do.
Yeah, thank you for highlighting some of the various ways that startups and corporates can partner. Often that focuses on, the pilot as sort of the primary end goal, but it sounds as though there's lots of stages and phases that are valuable to you.
Yeah, definitely. And
great.
It's good to have all of that in mind early on when you're creating that relationship from the beginning.
And how do you think about sort of having gone through this? And in a minute, we'll learn more about your specific collaboration. But what does a startup have to be ready to do? Do you think would you guide corporates to only work with startups that have achieved a certain level, or how do you think about that?
I think it really depends on what our corporate partner is looking for. So the most important thing, and I'm probably going to say this over and over again, but it really helps us if they have a clear goal in mind or a clear target or a clear experiment that they want to run. And then if that matches up with what we're trying to do. So sometimes you might be looking to work with an early stage startup, and maybe that startup wants to just test their MVP with you, minimal viable product, to gain experience or to learn from you. In other cases, you might be looking for a startup that has more established traction and has proven itself or validated itself and been stress tested in the market. And then you just want to see if the way it's been tested in other places will then apply to your environment. So it kind of depends on what the corporate partner wants to get out of it, and then making sure that that's aligned with what we want to do as a startup. And if they're both aligned, then you have a great recipe for a successful collaboration.
That's great. I mean, it goes back to what Steve was saying about building trust through being really transparent around goals. Steve, anything you would add to that point? Like, how easy is it for individual like you or a team member to be able to pinpoint that goal as they engage?
Yeah, I think aligning goals early is really important. And I would say, make sure it's a win-win for both organizations. So, that's the key. If, we're trying to, reach commercialization and the startup doesn't have the evidence in the build, it's not going to work well for both of us. So we need to make sure we're aligned there. The other thing is, securing the commitment of key business owners and stakeholders is critical. For any company that's working with a startup, you need an internal champion. You don't want the startups to come work with you and have the opportunity die because there's just a bunch of internal issues that need to be resolved. So, get your ducks in a row up front, I would say.
Mm-hmm. Great. I mean, great, sound, practical advice, and yet so often overlooked. So I'd love to turn to the partnership that you all have been forming and building, to hear more about how it got started and how you've worked through some of these very specific challenges. So if you don't mind, maybe Steve, from your perspective, what was the problem that Harvard Pilgrim Healthcare was looking to solve when they, turned to the startup world?
Yeah, absolutely. So, we've been exploring different areas of telehealth. And when we met with Ejenta, what struck us was they have a very flexible remote monitoring platform, and it really would allow us to improve quality and lower cost of care with a number of different populations. So it was less about we went in knowing we were going to focus on a specific population, but rather we knew we really wanted to work with Ejenta. And then the key became trying to figure out, well, what is the right opportunity fit? So what we did was we, with Ejenta, got together in a meeting with a bunch of cross-functional folks from around our organization. We had people there from clinical innovation, from population health, from care management, from digital sales, and a number of other areas, both in our commercial business as well as in our Medicare business, to kind of brainstorm what are the different opportunities. And then we went back and we thought about, how are we going to decide? And we looked at things such as the size of the opportunity and the potential ROI. whether Ejenta had done this before. So there's some of these solutions they've already worked with other health plans on. Others would be charting brand new territory. Whether we had other initiatives going on that would make it difficult to actually measure the success of the Ejenta pilot versus other things we had going on, and whether we had the right internal champion. And so using all of that together, we ended up focusing on commercial members with CHF as the population for the pilot.
That's great. I mean, it's so great that this conversation is dynamic but recorded, because that's just a checklist. Steve, you went off of like what needs to be in place. So like pause and rewind and write that down. That was great. And Rachna, from your perspective, what were your goals and sort of what brought you to the table?
Yeah, for us, we had piloted and even deployed this remote monitoring platform with other systems and other health providers. And for us, what was really exciting was being able to pilot in a new environment, working with a health plan. And so I'll just echo one thing that Steve said, which he mentioned, which he forgot to say his own role, which is really important to us. What was having this internal navigator who could help bring us to all of the different business units, because that's really challenging for a startup to do themselves. So having him was a huge asset and really helped us find the right people to align with.
That's great. And so tell me a little bit, like in the prior part of the conversation, we were talking about goal alignment. So what was the initial goal that you settled on sort of together, or maybe from each of your perspectives? And then how did you get to a pilot?
Well, maybe I could start by just talking about the problem that we settled on. So we found a business unit that was particularly interested in exploring how this type of a solution could help people with chronic heart failure with CHF. So if you look at that problem, it's a population that has a really high readmissions rate. About a quarter of them are readmitted to the hospital in 30 days, or half of them are readmitted within 6 months. So it's a huge cost to the health system. It's a huge cost personally to people and to their families. And so the question is, can we, by deploying this type of a system where we're collecting data from people in their homes, reduce this high readmissions number? So can we reduce the cost, the utilization costs? Can we improve health outcomes? Can we improve engagement, which eventually may lead to better retention of customers? So those are kind of the goals that we highlighted, and we've been able to prove that out with other customers. And so now the challenge is, can we prove it in the Point 32 system? And we found a stakeholder inside, with Steve's help, that was really aligned with that goal. So our success would be their success, and that's the best kind of experiment to run.
It's exciting. Steve, anything you want to add?
Yeah, no, that was great, Rachna. And of course, we share all of those goals and objectives. It is about lowering cost and improving quality. But the other thing for us, we had done some looking early on about, where can remote monitoring have the biggest effect? And we actually did a study with some Cornell students, and CHF came out as one of the top areas. So this is actually the first time we're doing remote monitoring for CHF, and that's exciting for us. The other thing is, internally, this is enabling our care managers to have more access to tools and proactive member outreach. So there's a, kind of a benefit in how we do our care coordination.
Wow. I mean, it truly sounds like a win-win with really extraordinary outcomes for patients. So we're excited to see. I understand that this next phase is just getting going. So we'll hopefully check back next year. Before we wrap up, were there any stumbling blocks in how this partnership came to be that you're comfortable bringing to light for others to learn from?
So, I don't know if I'd call it a stumbling block per se, but, you always have the issue with privacy and security screening and legal and all of that. And that's a very slow process and a slog to go through. And I appreciate the patience that Rachna and others have as we go through that. The other thing is, working with legal on such things as like liability disclaimers. Who's responsible if something's happening off hours and our care managers aren't there, those kinds of issues. So, there's no roadblock, but there's things to consider along the way.
Yeah, and very real. We at MassChallenge talk a lot about startup enterprise readiness, meaning is it not just in terms of sort of culture and team design, but then these really basic things, as you say, like compliance and security integration. And have you been able to work with a smaller company effectively or change or modify your process if needed? Rachna, from your end, anything you would add to the lessons learned camp?
I don't think that this necessarily applies to point 32, but just in general, something that corporates can be aware of in working with startups is, like Steve mentioned, just reducing the red tape is helpful. We operate on a different time scale than corporates do. We have a certain runway, which for most startups is typically 18 to 24 months, where we have to demonstrate something and meet milestones, to raise our continued funding. And then the other thing that can happen, it hasn't been a problem in our relationship, I think, because we have great communication, but it is something to watch out for, is the idea of scope creep, where the corporate partner may ask the startup for a particular feature or something that can subsume their whole roadmap. So that's just something to be aware of. And I think, we've had great communication where we can say, look, we can do this, or we can make this configuration change for you, but maybe this other change that you're asking for, let's do it in phase 2. So I think it just requires good communication and transparency on both sides.
Great, solid advice. So I know our time is come to a close so quickly, actually, but I want to wrap with a chance to give your insight and recommendation one more time. So Rachna, from your perspective, what do you wish corporations in this audience knew and understood about working with entrepreneurs and startups?
Yeah, so I already mentioned the timescale issue, that we work on a different timescale and scope creep can be a problem. I think the most important thing I would recommend is to do what Point 32 did, which was to have a navigator to help us navigate the system. I think, in addition to paying for the pilot, I think it's also important to show a commitment by bringing your A team to the table and bringing the right people into the room, and obviously having your strategic priorities aligned. That's been the most beneficial to us.
Fabulous. And Steve, ending with you, what have you learned through the past years working with 9 startups through MassChallenge, probably more beyond, that you want to share with your peers in the audience?
Yeah, so I think you have to go in with eyes wide open. You want to make sure you have an internal champion. You want to make sure the cross-functional stakeholders are aligned. You want to make sure that you're testing a novel solution, a problem that you're going to get a lot of benefit if you solve. And then you want to ask yourselves, well, what are the next steps? So, assuming this goes the way you want it to, who's going to own this? How are you going to scale this up and make it more impactful? And from the startup side, again, I'll harp on trust and making sure that what you're hearing is, the truthful answer and not the here's where we would like to be, but we're not there yet. And I think working with the right people. I can't say enough about Rachna and Martin, the co-founders. They've worked directly with us. They haven't, pushed us off to other people in the organization. And it's their experience that's really helped this thing gel and get to where it is today. So thank you very much.
Awesome. Well, thank you so much for this extraordinary, candid, chock full of recommendations conversation, and for being willing to share your own experience working together for others to learn from. As I started with, we are huge believers that there is extraordinary power in startups and corporates coming together, and really excited to be here today, helping shed light on how to do it better.
And I just want to thank you, Cait, and thanks, Steve. We wouldn't have been able to do this without you.
Thank you.
Likewise, we are firm believers in the MassChallenge Health Tech program, as you know, Cait, and we get a lot of value out of it.
That is great to hear. Thank you all. I will carry those kind words back to the team. That's what keeps us going.